Hello students, I am Dr. Mathew Jacob, Associate Professor from the Department of Oral Pathology, Vinayaga Mission Shankaracharya Dental College, Salem. Today we are going to discuss on the topic deciduous and permanent teeth or dentition. So these are the contents which I will be speaking on. I will give a brief introduction, followed by which I will be telling about the tooth numbering system which will be followed for both dentitions. I'm trying to differentiate how we number the deciduous and permanent teeth, after which I will be telling about the eruption and shedding with regards to the deciduous dentition, and the next I will follow up with the differences between the deciduous dentition and the permanent dentition. I will be focusing on the morphology and the hard tissue structures of the tooth, and last I will end the slides with the clinical considerations which must be taken into account in different specialties of dentistry. We have the deciduous or the primary dentition and the permanent and the secondary dentition. So what we can see is that there are several different aspects of these tooth which we must know in order to practice dentistry, especially pediatric dentistry. So those different aspects or the key aspects which we can see are in the number of the teeth, the eruption in case of deciduous tooth, and shedding again in case of the deciduous tooth, the size and shape of the crowns and the roots, as well as the hard tissue. In the tooth numbering system, there are three main systems I will be talking about. We have the universal or the ADA system, the PAMA notation system, and the ISO FDI system. Now in these three systems, what we can see is that in the universal system, the permanent teeth are numbered from 1 to 32. So it will be 1, 2, 3. And in case of deciduous tooth, they are not numbered, rather they are labeled from A to T. In the PAMA notation system, here as the name suggests, there is a notation. That is, we have quadrants with each having its own symbol, which I shall explain. Followed by the quadrant symbols, the tooth are numbered from 1 to 8. In case of deciduous dentition, we have the same quadrant symbols, and here again the tooth are not numbered, rather they are labeled from A to E. In the ISO or FDI system, we have the two-digit system wherein the quadrant and as well as the tooth is numbered. In case of deciduous tooth, it is following the two-digit system, again both representing the quadrant and the number, which I shall explain in detail. This is just an example. As you can see, there is a quadrant symbol followed by the tooth in that particular area. In case of the FDI system, we have a two-digit system. One represents a quadrant while the other represents the tooth. In the tooth numbering system, as we can see here in the PAMA, I have tried to represent it in form of quadrants. We have a quadrant symbol which represents each quadrant. In case of deciduous teeth, the tooth are labeled in capital from letter A to E. In permanent, they are numbered 1 to 8. So to give an example, what we can see here is that there is a symbol followed by the letter number 2. So each quadrant has its own symbol. In case of the FDI or PAMA system, it is a two-digit symbol. The first number represents a quadrant. In case of permanent teeth, it would be 1 to 4. In case of deciduous tooth, it would be from 5 to 8. And the second digits represents the permanent number of the tooth, that is 1 to 8 in case of permanent teeth, and deciduous it is 1 to 5. Now coming to how many teeth are there in each quadrant. Now for the purpose of representation, I am going to magnify one particular quadrant, and this particular quadrant I shall try to explain the number of teeth. So each quadrant has 5 teeth. Formula would be a central incisor, a lateral incisor, a canine, first molar and second molar. These are all the deciduous teeth. What we can see here is that we do not have premolars. So we have 5 teeth, 4 quadrants, so a total of 20 teeth. In case of permanent, what we see is that we have a central incisor, a lateral incisor, a canine, and the permanent molars are replaced by the premolars, that is 2 premolars, premolar 1 and premolar 2. So this occupies the space of the molars. And then as the jaw expands, we have 3 subsequent molars which form. So we have a total of 5 plus 3 teeth. So each quadrant will have, in case of permanent dentition, 8 in each quadrant. That gives a total of 32 teeth. Now when it comes to eruption and shedding, we have eruption in both deciduous and permanent teeth, but we do not have a normal shedding in case of permanent teeth. If any shedding or exfoliation or any tooth loss were to occur, it would be due to a pathology. Now in case of eruption dates, they are usually given in form of months. So as we can see for deciduous teeth, so we can see central incisors, the eruption is from 6 to 12 months, in lateral incisors 9 to 16. First molars is from 13 to 19. So what we can see here is that the first molars erupt first, followed by the canines, and then the second molars. The second molars is from 22 to 33 months. And once the complete deciduous dentition has formed, the shedding begins around the age of 6 and is completed by the age of 12. So when we look into the permanent dentition, the first molars, usually the first tooth to erupt around 6 years. So when the shedding begins, we have the first molars which start to erupt into the oral cavity. Then the next sequence is central incisor, lateral, then we have the premolars, not the canines. We must note that the canines erupt after the first and second molars. So, and then the canines followed by second and the third molars. Now, what is the purpose of me trying to emphasize here is that we must know the sequence by which the eruption or the shedding occurs. Thereby, we will be able to plan the treatment and management of malocclusion. So, what are the basic differences in case of a deciduous and permanent dentition? Here, we will be talking basic general size and shape. So, as we can see, the deciduous tooth are smaller, whiter, smoother, and have a definitely more bulbous crowns when compared to permanent teeth. They have a pronounced cervical ridge, which I shall explain in the subsequent slide, the clinical significance of it. The next important point is the roots are more flared and slender. Now, important point here is that the roots are flared. The purpose of this is that we have the consequent or subsequent permanent tooth bud which is forming in between these roots. So therefore, the multi-rooted teeth are usually flared, therefore providing space for the permanent tooth buds. Now coming to specifics of incisors, they are more broad, the crowns are more flat, and there are no mamelons. In case of canines, they are more broader mesiodistally, and they have prominent cusp tip. In case of molars, they are more wider mesiodistally than buccolingually. What we must understand is that we see a mesiodistal discrepancy when compared to permanent teeth. The reason being that this provides more space for the permanent tooth to erupt. Then what we see in permanent tooth is that here, apart from the major differences, what we see is that the size and shape of the tooth are more sharper, more pronounced, which help in the mastication of an adult. Now moving on to specifics in case of histological differences between enamel, dentin, pulp, root, resorption and function. We have the enamel, which is thinner and less mineralized, and the enamel presence are less defined. So what we must understand is that the enamel is more prone to dental caries, and the density in case of the permanent tooth of enamel is more higher than that of the deciduous. In dentin, what we see is that the dentinal tubules are thinner and wider. Therefore, it is susceptible to wear and the caries. Therefore, a preventive action should be taken in case of deciduous teeth. In case of pulp, what we see is that if you look at the pulp changer, they are more larger or relatively larger when compared to the tooth size. They have more prominent pulp horn and higher cellular content. In case of permanent tooth, we do have a cellular content which gradually reduces as the age advances. So therefore, what we see is that the size will reduce, the fibers will increase, less cells will reduce, and then as very clearly told, it will be a defined pulp chamber. Next we have the root resorption. There is physiological root resorption which occurs in case of deciduous teeth. As I mentioned, we have the permanent tooth bud which will follow the eruption, that space. So therefore, it undergoes resorption, allowing the eruption of the permanent teeth. In permanent teeth, there is no resorption unless and until it is pathological or maybe due to orthodontic treatments, which again is pathological. Now pathological again will be internal or external resorption. So what is then the function of a deciduous tooth? In simple terms, they act as placeholders, or they hold the space for the succeeding tooth and also helps in the development of the jaw. Now moving on to the clinical considerations. There are so many aspects which we must consider when treating a deciduous tooth based on its morphology, the differences in the size and shape compared to permanent teeth, and also keeping in mind that the function of the permanent teeth. So based on this, we will take a few specialties. That is, first and most important, the pediatric dentistry, because pediatric dentists are the ones who usually see the teeth in the deciduous dentition, and as the child grows older they move on to the other specialties. Therefore it is critical for a pediatric dentist to be aware of these morphologies, therefore be able to provide the appropriate treatment. Now in coming to restorative management, the unique anatomy of these teeth, as I mentioned before, have to be considered to avoid damaging the large pulp changes, especially in case of restorative, that is class 1, class 2 cavities. Next is in caries management, because of the relatively thinner enamel and dentin, the wider dentinal tubules, the less density of the minerals in case of hard tissue enamel and dentin, they are more susceptible to caries. Therefore, regular and frequent checkups to preventive measures should be done in case of caries management. Next important point, as I mentioned, what are the functions of these deciduous tooth? They act as placeholders. They prevent the inherent movement of the teeth, thereby closing the space due to loss of deciduous teeth. So early loss must be prevented, and if at all a loss of a tooth occurs, we must take the measures to maintain that space by using space maintenance. In orthodontics, here we have to understand the eruption, the shedding is very important for an orthodontist. Therefore they will be able to treat and manage accordingly, knowing when or which tooth erupts, and therefore accordingly providing an appropriate treatment. For example, myofunctional appliances, utilizing or harnessing the musculatures around the face, and also supporting the jaws in growing or trying to limit the growth of the jaws, providing a balanced occlusion, and which can be both aesthetic as well as functional. In case of endodontics, usually the endodontic treatment are done by pediatric dentists. However, sometimes they may require specialists. Therefore, usually treatment protocols are pulpectomies or pulpotomies, trying to preserve the hard tissue of the root, thereby allowing the tooth not to exfoliate early and to remain in the space, providing the natural space maintainer, which is the best when compared to artificial or other space maintainer. In preventive dentistry, again, this is critical because of the hard tissues of the enamel and the dentin. Therefore, a simple solution such as sealants or fluoride treatments can prevent the erupted tooth from undergoing decay. In case of prosthodontics, as I mentioned before, the crowns are bulbous. Therefore, preformed crowns can be utilized in case of deciduous tooth, which is vital in case of trying to preserve the crown in case of grossly destructed tooth. And in the specialty of periodontics, the gingival health is critical. So gums around both the deciduous and permanent tooth must be maintained to prevent any periodontal disease which can affect the permanent tooth bud, which will erupt after the deciduous dentition. So the textbook which should be used in case of tooth morphology, or even to appreciate the deciduous or the permanent dentition, the morphology, the histology, and also of the roots, is Wheeler's Dental Anatomy, Physiology and Occlusion, given by Nelson Stanley J. Thank you for paying attention.